Welcome to the Concussion Fix Podcast, where we lift the veil on concussion recovery and empower you with real answers to real questions about persistent concussion symptoms. Each episode, you'll hear real, live Q&A sessions with real members of the Concussion Fix program, an online recovery program that has helped more than 3,000 people find relief from their persistent concussion symptoms. Guided by our experienced clinical team, Dr. Paul Hrkal, Melinda Krynen Hill, and myself, Dr. Cameron Marshall, we're here to share insights, empathy, and a clear path forward. In order to protect the privacy of the members, we have stripped away names and blurred faces. Please remember all information shared is for educational purposes only and should not replace medical advice. If you need extra support and guidance for your recovery, we encourage you to check out the Concussion Fix program by visiting concussiondoc.io or Google Concussion Fix and read some reviews and see if it's right for you. Whether you're looking for answers, hope, or just a little bit of encouragement, we're here for you. You're not alone. Recovery is possible, and it starts right here.
Good morning, everyone. We also like to celebrate wins in the Concussion Fix program. So this week, we want to celebrate who came into the program at 96 out of 132. And when she left the program, she was at 7 out of 132, which is absolutely amazing. And then started the program at 67 out of 132 and is currently at 21. She's continuing to implement the strategies she's learning, and that number will just continue to decrease as she's going. So congratulations to both of them who have had amazing drops in their symptoms. All right, we can go to first question, which is...
Hi, Nikki, I didn't hear you at first. Did you say that Melinda wasn't here today?
Yeah, unfortunately, she's off sick today.
Okay. I had kind of a twofold question. Part of it was mainly for Melinda, and I think the other part is mainly for Dr. Hrkal. So I will try to ask. I was on the call a month ago where I had a somatic experience therapy the day before, and I had a flare-up in my neck. And I've been dealing with my neck ever since. I've never gotten back to my baseline. Sometimes it's worse and sometimes it's better. And then around Friday last week, I had a pretty bad flare-up again. It's like the SCM muscles have been stuck for the past month, and they were just really, really sore. And I had pain in my neck and my upper back, and dizziness, nausea, and fatigue. And then around the weekend, I think Sunday, I started taking ibuprofens for the pain, around 2 to 3 times a day. And then on Tuesday, I saw my family doctor, and she prescribed a muscle relaxant to try to break the circle of the tension. And I took one pill on Tuesday during the day, and then half a pill at night. The one pill that's the normal, what do you call it?
Dose? You're talking about
Yeah,
dose?
the normal dose, right, for people, but it was clearly way too much for me, because it felt like I was on drugs. I was like I was just slowed down and just off. But it did its job in relaxing the SCM muscles. And then in the evening when it weaned off, I started having like crazy pain in my what do you call it? Just a second. The solar plexus area, like to the level where I just wanted to scream. And so in the evening before bed, I took ibuprofens again, and then half a pill of the muscle relaxants. And then I got some sleep and it helped. And then the next day, when the effects started weaning off, I started having those pains again. And during the day, the more the medications weaned off, the stronger the pains got. And then I talked to my doctor again, and she thinks that it is the ibuprofens that I was unable to deal with because of acid reflux. I had a colonoscopy 11 years ago where they diagnosed it. So I know it's there, but it's not something that I usually think about. And now she put me on medications for the acid reflux to try to calm it down. But I still have a lot of pain. I hope it's because it just takes some time to work. So I guess my question for Dr. Hrkal is mostly about how to adjust the C-fix diet to not make the acid reflux worse. And also the question I had for Melinda was more about how to cope with this mentally, because I feel it's a lot. It's been a hard week and I feel quite overwhelmed, and I'm used to dealing with a lot of pain in my neck and my head. But I think I got really scared when I had such severe pain in my solar plexus area.
Okay, so just to be clear, it sounds like the type of pain that you're having in the center of your chest or your solar plexus area is it a burning type of pain? Can you just describe the character very briefly?
I um I don't really know what it means to have a burning kind of pain, but it's like it feels like I have this knot in just below my chest, between my rib cages. Like it feels like everything is sucked into this. Oh, and it gets a lot worse when I lie down. So it's worse at night.
Okay. Yeah, that most likely is the case. Have you discontinued the ibuprofen?
Yes, yes. I changed to, well, I came back to my family doctor yesterday because the pain was so severe, and she gave me some other pain relievers that are they're very mild, so I don't know really if they do anything, but they also don't make things worse. I
Okay.
don't know if it's the English word. It's called paracetamol.
Yeah, that's Tylenol. Yeah.
Okay.
Yeah, that's the British Tylenol. Okay, so it sounds like that class of medications that have the anti-inflammatory effect, so that's like ibuprofen, naproxen. If you had some sort of existing, I think you meant to say an endoscopy, not a colonoscopy, but that's an assessment of down your throat to look at if you have an ulcer. So if you have an existing ulcer, you take that medication, it will get a lot worse. Of course, I think the first line of therapy is to discontinue the thing that's causing it. And secondly, then to prescribe acid blocking medication, which is there's a whole number of them. Nexium, Prolosec, pantoprazole, and those are acid blockers, and they're helpful short term to decrease the symptoms. But if you have a very severe aggravation of maybe an existing ulcer, which is what it sounds like it is, then uh, then it's just gonna have to heal. It's gonna take some time to repair itself. Uh, if it continues, I suggest that you should go and have another endoscopy. If it's as severe as you said, go back to your family doctor. They may have to refer you to a gastroenterologist to actually do that, and then they may have to remedy those ulcers in other ways to figure out like why is the ulcer there in the first place, for example. In terms of answering your question, the diet. With these types of acute situations, you just want to avoid acidic foods. So, like things like vinegars, citrus fruits, any sort of even things like apples with malic acid. These can irritate the lining of your stomach and your esophagus. So, avoid those. People will say coffee, alcohol, and tomatoes also are fairly strong aggravators. So avoid those. But other than that, the concussion fix diet doesn't need to be modified too much. This is an acute situation that happened because of a medication. And so it's when it's very strong and acute, then diet kind of has a background foundational role, but medications are needed to kind of manage this.
Okay. Apple cider vinegar, is that good or bad? I take it every morning because it helps my digestion. And if I stop taking it from one day to another, I get a stomach upset.
What can you say it again? What was the name of it?
Apple
Apple
cider.
cider vinegar.
Uh, that if you have an ulcer, then that is not good for you to take, even
But
though you may be able to tolerate it before. Unless, I mean, this is a theory, unless it's not an ulcer.
but can I ask you, you say ulcer. Uh, do you use the word acid reflux in English?
Yeah, yeah. So acid reflux just describes that the stomach acid that's there for everybody, that's normal, that's good. It now gets past the door at the bottom of your esophagus. That's called the esophageal sphincter, and now starts going up into your esophagus. So that's called acid reflux, and you can feel it kind of in your chest. And it might even go up to your throat. You might have a sore throat. You might have a burning sensation and kind of a bitter taste in your mouth. These are all possible symptoms. But if you have a tremendous amount of pain, that's located in the solar plexus. Again, if I stand up slightly, the solar plexus is right here.
Yeah, that's
That's
what
where
I
you're
heard.
having the pain?
Yeah.
Yeah, so that may be something I would say a step higher than acid reflux, and that actually can be an ulcer, which is an area of damage that's happened in your stomach. So that's no longer acid, that's over and above acid reflux.
Okay. Okay, because my doctor just said acid reflux, and that was also what they found so many years ago.
Yeah, again, acid reflux is it's a symptom. It's not something that you can find. What they would find is you have an irritation of your esophageal lining, or you have you have an erosion of the stomach lining. That's a finding. Acid reflux is a symptom that describes the way you feel. That's it.
Oh,
You see the difference? Like an acid reflux is something that your body's interpreting as painful, but it's not really telling us what's causing it.
okay. So you think it's an ulcer?
Well, the reason I say ulcer is because of how severe you've described the pain. Like that's the one thing that really will become extremely painful if you have an ulcer.
Yeah, it's been really, really painful.
Yeah, so family doctor should actually should take a look down. Any change in stools? Do you notice that your stools are darker or anything like that?
No, my urine has been a bit darker, but I don't know if it has to do with the medications I've been taking.
Yeah. I have to say, unless it's mixed with something like typical muscle relaxants, like cyclobenzaprine, for example, I don't know which one you're taking, but they should not cause the type of damage to the stomach. Uh,
It's called pantoprazole.
yeah, so that's the acid blocking medication. I'm talking about the muscle relaxant.
Oh yeah. I forgot.
Yeah,
Um,
so it's really the ibuprofen, or really actually even worse than that is naproxen, and that is major when it comes to stomach erosion.
okay.
So I guess the only thing that doesn't make sense in this in your kind of report of what you said is that the muscle relaxants caused the stomach pain and ulceration. That's not typical.
No, the ibuprofens
Okay, so I just wanted to make
because
sure.
of the acid reflux.
Yeah, okay. So yeah, avoid all that. And then, there are foods that you could consume that are helpful for healing the lining of the stomach. So for example, any sort of herbs, like for example, marshmallow, licorice, slippery elm. These are teas you can find. You can even get them as a herb. They coat the lining of the stomach. So they're complementary. They don't replace pantoprazole. Nothing is stronger than pantoprazole to block stomach acid. This is the reason this drug, I believe, is really shines in these situations. They can help protect you from having very severe symptoms. However, it's a short-term solution. We need to figure out why is it there. So if there was some acid reflux previously, I suspect there probably is more now, and based on the severity, I suspect that it's possibly an ulcer, and that should be at least ruled out.
Okay. We have a national holiday here, so my doctor is away until Monday or Tuesday, I think. The pantoprazole, will that help until
Yes.
then?
Yes,
Okay.
exactly. Keep going with that. 100%. Keep going with that. Avoid anything acidic and vinegary. I know you said it helps your digestive system. If you have acid reflux or ulceration, I think that in this case, I would avoid it and instead go with things like some sort of like digestive healing tea, soothing things. Like you can hear in Canada, I don't know where you're located. Uh,
Denmark.
yeah, you can see if you can source these like lozenges, like chewables, like licorice extract. They just coat the lining of the stomach. You might be able to find this at a health food store, at a pharmacy, but nothing bitter and nothing acidic.
Okay, so no like lime juice or lemons or stuff like that. Okay. Herbal tea, is that
Yeah,
okay?
herbal tea is
Okay.
good. Herbal tea is good, except peppermint, not peppermint.
Okay.
The
I
reason you don't
think I
want
got it
peppermint
now.
is because it relaxes that lower esophageal sphincter, which is it's good for spasm down further on down the gut. But right now it looks like we're focused on that. So I think for now, you're in this kind of state that you need to just calm the immediate symptoms. And diet is not going to be a huge game changer, other than avoiding things that are going to be more irritating. So I think we talked about that so far. Okay,
Okay, yes, thank you so much.
that was a good question. Thank you.
I just have a question on just like, you said that your neck tightened up, which is the reason you went with muscle relaxants in the first place. Have you had any work done on your neck? Like,
No, I keep thinking about it, but the thing is, I'm scared it will flare things up even more. The work I did with the somatic experience therapist, uh, it wasn't planned. Like, it wasn't planned that we were supposed to work on trauma and work on neck. For the past 6 months, we've been working on calming the nervous system and building resilience. And this sort of just came up at session. So, yeah, it wasn't intentional.
okay, I'm just thinking like, um, because if we once you start going down the path of like medication, it's like, okay, you take muscle relaxants and ibuprofen. Now we end up with a potential stomach issue. Now we're on acid blocker, like you know what I mean? And then you just end up in this whole medication soup that, I mean, even if you look at the side effects for muscle relaxants, it's, drowsiness, fatigue, dizziness. So a lot of the same symptoms start to emerge, and then it becomes confusing as to what's actually driving it. Is it the muscle relaxants causing these symptoms or other things? So I I tend to lean more towards let's try to fix the problem, right? If the problem is the neck and tightness and SEMs, and you've been doing work to calm the nervous system, it might be worth getting a little bit of light work done rather than taking medication to mask the symptoms. You know what I mean? Like the symptoms are just a sign that something's wrong. So rather than just suppressing the symptoms, let's fix the actual problem. That might be one way to go. Now, it can flare you up, of course, but taking all these medications has created another problem for you, right? So it's kind of a risk either way. Anyway, just a thought.
The somatic experience therapist, she says that working with my nervous system is like working with a field full of landmines. And like wherever you go, there's just something exploding and you don't know where it is and you don't know what will come up. So that's how my body is. So that's why I've been so cautious.
Right.
And I've
Right.
been flared up for a lot less.
Right. I mean, and it's okay to be flared up. Like I would expect to be flared up. Like most patients I see, I'll tell them like this is probably going to flare you up. But after we do it a few times, then it becomes less and less, and your body kind of
Okay.
adapts to it. So don't be too afraid of these temporary flare-ups, because ultimately you kind of have to get through that in order to get to the other side. Sometimes you have to get a little bit worse before you can get better. Um, so don't be too afraid of flare-ups, right? Don't be afraid of symptoms. It's just a sign that there's something going on there and we can keep working on it to fix it. So,
Yeah.
um,
It's more like it's not because I'm afraid of having like 2 to 3 days of flare up, but it's like for instance with this somatic experience therapy, it flares me up so bad that I can't function. And then, I have problems with cooking and doing
mhm,
laundry um and then I have issues because maybe I don't eat the right food or, it
right.
escalates. That's
Yeah.
my issue. And
Yeah.
not because I'm afraid of a little flare up, but it's because it just blows up the whole foundation. That's my
Right.
issue.
Yeah. That's understandable for sure.
Yeah,
Yeah.
I keep thinking about it, but I don't know what to do.
Right. I mean, maybe just some light work to start. Like, I don't know if you can find somebody that does like very light stuff,
Do you
just
think
uh,
massage would work?
sorry.
Massage? Do you think that would work?
Possibly. I mean, it depends because massage can be very deep as well, right? And you're probably looking for something more just like relaxing, like, like a Reiki type situation where you're barely, you're not applying a lot of pressure. It's more just like a relaxation type massage. That might be helpful to start, um, that type of thing. Like even like a stone, something just more relaxing than anything, just kind of like um, rather than like a deep tissue type of massage. That might just be a good place to start, just to get used to touch and, just kind of slowly easing into going deeper. That might be the way to start for you.
My family doctor, when she prescribed the medication, she did an examination and she touched my pressure points. Is that what you call it? In the neck and the back, and it was so nice.
Yeah,
But it's like I know her and I'm comfortable with her, and it was just that and just 2 minutes. And I actually came back the next day just to ask her to do it again.
right.
Um,
So, and this might be
yeah,
something that you respond well to, right? Because everything is so interconnected. So, for example, if you have neck dysfunction, that's going to throw off your nervous system.
yeah.
Because your neck is very intricately connected to all the sensory stuff that goes on in your brain and in your vision. And so if your nervous system feels off balance, it's going to create more sympathetic output, which means you're more kind of on edge just as a baseline. So the fact that when she pushed on those trigger points, you actually were like, "Oh, this is nice," tells me that maybe getting some work done, because sometimes if you get some neck work done, that will actually help the nervous system to balance better because those trigger points go away. You get better input to your brain, and you're not on this kind of like, oh, things are disconnected. It starts to become more connected, and you feel more calm. Like there's a lot of linkages between autonomic dysfunction and neck dysfunction. And so maybe one of the things is like you're working on all the other parts of the autonomic system, but the neck dysfunction is keeping things in a fight or flight state. So it may be worth exploring that a little bit.
Yeah, that's so true. Do you then have any advice on, let's say I try to get my neck treated, like how do I deal with having such a difficult time with managing the foundations? I'm struggling with everything, things like cooking and cleaning and stuff like that. That's my issue. And also, it took me 2.5 years to realize, but I just realized now that even walking flares up my neck. I made a post recently about the stationary bike I bought.
Mm-hmm.
Um, and yeah, even that's a problem for my neck. And I found a practitioner that is educated in ART here in Copenhagen.
Yeah.
But he's at the other end of Copenhagen, so I have to go by train and bus and walking. So it's a really long way for me to get there.
Yeah, I don't think you need like ART at this point. I would just try to find a massage therapist and just like have a conversation with them before you get into anything. Like just say, look, I've been dealing with this. I have a lot of like dysregulation, and I tend to get really flared up really easily. So I'd like to just start nice and gentle with like a little bit of trigger point application, nothing deep, and then they'll hopefully be able to just meet you at that point, right? Like a
Okay.
good practitioner will listen to what you have to say and say, okay, I'll take it very easy to start and just to see, like you might even just start with just very gentle, touch, and then that will help build trust, increase your comfort level, so you kind of have to ease into these relationships. Um, and so I would, ask around to some friends if they know, good massage therapists and just kind of, feel out, maybe call a few clinics or go into a few clinics just to have those initial conversations and see if you kind of resonate with somebody and build that kind of trust and just start slow. And I think it'll be good for you. I think it'll help to just start addressing some of these things because if you have neck dysfunction that's causing a lot of this autonomic dysregulation, it's almost like you can't move past this part unless you get that treated, right? So that can happen as well.
Does a massage therapist need to be specialized in neck or concussion, or
I,
just
I
good?
don't I don't think for where you're at this point. I think for
Okay.
what you need is just, somebody just to start kind of pushing on some of these trigger points. You may eventually get to a point where they've peeled back a few of the layers, but they're not getting into like, now when you need to go deeper, now it might be worth the trip to the other side of Copenhagen for ART. But I don't think you need that right now. I would start just with some gentle stuff just to kind of get in the groove of it. It'll help a little bit, right? Just even pushing on those trigger points you said felt so good, right?
Yeah,
Even
and I
that,
feel like a few minutes, that's enough for me.
right. And that might be it. Like you might start with like a 10-minute massage, like something just very gradual. And as long as you explain to the massage therapist, I just need to start really slow because I have all of these other kind of issues, and then hopefully they can meet you where you're at, and then if it's good, then okay, I'm gonna keep going back to that. But if you just do a little bit, it shouldn't flare you up too much, right? And if it's gentle, it shouldn't flare you up too much, but I think what it'll do is start to help you build trust, and then as you do that, they can get in a little deeper and a little deeper and a little deeper, and then you may be ready for ART after a few months of that, you know what I mean?
Yeah, I hope this plan will work because that would be so nice.
It would. It would. I mean, just the fact that you felt that it really felt good when the doctor did it, I think that's a good sign. I think that's a sign.
Yeah, it was so good because I've had so much pain and it was just the right spots. Okay, thank you guys.
You're welcome. Okay, next up is
Hello.
hello.
So I had a question regarding long-term management of chronic neuroplastic or nerve-driven pain, specifically questions for breaking the chronic pain cycle stemming from overactivated nerves, ideally without relying on heavy medications. So, to give you some context, I'm 4 years out from a head injury, which has led to persistent symptoms. My main symptoms had to deal with it was like eye aches, um, neck referred pain, as well as numbness in the right extremity, so the hand and foot. So I've been doing visual rehab as well as cervical rehab, which includes like a TMJ component to it. So with the visual rehab, I'm going to be discharged in about 3 weeks. So I've been doing it for a few months now. They said my convergence was above normal level and the divergence is almost within range. And then for the cervical rehab, we discovered about 2 months ago that there was a TMJ component that was likely contributing to a lot of the symptoms that I'm having. So, but thankfully, with the cervical stuff we've been doing, so we did some neck strengthening, we did sensory motor stuff, we've done some dry needling. It's improved the cervical mobility, uh, but there's still that TMJ component which we're working through. In fact, I see an oral facial specialist once in a while, and they had given me like an orthotic splint which I wear at night, and then with my cervical PT, we do some TMJ stuff. So in addition to that, the oral facial specialist had given me like indomethacin, which is like a short-term anti-inflammatory, and I'm taking supplements like vitamin C, D, magnesium, and fish oil to support the process. However, there's this thing regarding uh, my 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 nervous system being, or at least the pain receptors being overactive, and thinking through ways to desensitize it without having to. Yeah, so essentially, I'm just curious about some like effective non-pharmacological strategies that you would recommend for quieting these like overactive uh, um, pain receptors or nerve pain, because I think that's partially what's still causing some of the eye aches, even though visually the tests are looking good for things. And like the nerve pain regarding the eye aches, the headaches, the neck stuff, the numbness and tingling in the extremities. So I'm just kind of curious about addressing these like peripheral uh, drivers that are related, that are being rehabilitated, but still like central to sensitization that may linger.
Mhm. Um, all right, thank you for sharing. Maybe I'll start, Kim. I'm sure you want to input, but I do work a lot with chronic pain in our clinic, and so we see these types of presentations all the time. So it sounds like you're going about things the right way. You're obviously in the program. You're working your way through the concussion fix. Have you made it all the way through Melinda's sections yet?
Uh, is Melinda was it the psychological
The
part of it?
psychotherapy, yes.
Yeah, so I'm actually about 50 something percent of the way through the program. So I made it through that, the nutrition piece of things, the sleep piece of things, and exercise and all of
Okay.
that stuff. Yeah.
Okay. And have you found that implementing some of the things that Melinda talks about, do you find that that makes any difference in terms of the symptoms you've described when you are practicing mindfulness?
So I got on this program. So I do try to meditate about 5 times a week, so 5 days out of the week. So I started this program in tandem with the visual rehab, as well as restarting the cervical rehab part of things. So I think over time, I've noticed an improvement with everything I've been doing. The only thing that I haven't quite noticed the improvement with is like the nerve related pain that keeps showing up still in these parts, like the eye, the neck.
Yeah.
Yeah.
The reason that I ask about that is because there's with any sort of nervous system sensitization, again, we should probably differentiate that. When
Mhm.
your nervous system's hypersensitive, that means you're sensitive to any sort of stimuli. That's a bit different than neuropathic pain. What you're describing, I think, is neuropathic pain. Is that right?
Yes.
Okay,
Yes.
so that's not so much like nervous system hypersensitization, which is very responsive to the things that Melinda talks about in the psychological and mindfulness sections. If it's just residual nerve related pain, numbness, tingling, burning sensations, these are the classic types of characteristics that describe that type of pain. Now we can really go into the nutritional world and really have a beneficial effect. So I'm assuming you're following the concussion fix diet. Sometimes gluten seems to be a big trigger for neuropathic pain. So I'm assuming that you've tried to be gluten free as much as possible and you've given that a shot. After that, there's a couple things that I'd suggest for you to explore. One of them is a specific type of magnesium called magnesium L-threonate, which is able to get into your nerve cells better and get into the central nervous system better. That seems to be the one that's most beneficial for nerve-related pain. Secondly, there's a particular mushroom called lion's mane. Lion's mane has been studied to, again, improve nerve growth factor, which is one of the important factors in recovering from neuropathy. Number three, there's something called, it's a funny name, it's a long name, so I don't expect you to remember. It's called palmityl ethylolamide, which is PEA for short, so PEA, and that has research showing that it helps decrease nerve-related pain. It's been studied extensively in Europe for many different types of pain, and it works really interestingly by working on the endocannabinoid system. So this is something we haven't talked too much about here, so I just wanted to let you know about it. I would say those are kind of the top three. There are a couple other ones, alpha lipoic acid and carnitine. These are some of the things that I'd be looking at in terms of neuropathy. Also making sure you're getting enough B12 specifically, because it helps regrow the myelin sheath. So I know I'm throwing a whole bunch of things here at you, but hopefully you're recording them and writing them down. And something for you to talk about in terms of the doses. This is where, I'd suggest you can do a little bit of your own research, but also, working with somebody that is knowledgeable in this area to implement some of the dosing, because sometimes you need higher. Now, the last thing I'll say is sometimes, these are the nutraceutical approaches. Sometimes you need a little bit of a combination of pharmaceutical and nutraceutical, and we've talked about something called the low-dose naltrexone before. It's a medication that works on microglial activation when used in low doses. And this is actually really synergistic, I think, with some of the things I just mentioned because of its unique anti-inflammatory effects, specifically for this type of pain. It's kind of like neuroinflammation, nerve-related inflammation. So that would be something, again, it's too much of a conversation for this moment, but I think that, it's something for you to talk to your healthcare provider about. There are medications like gabapentin, Lyrica, these types of medications that decrease the sensation of nerves. I find that they're just band-aid solutions. They don't really help solve the problem. All the things I mentioned so far actually help promote nerve repair and nerve growth. So it takes a while for nerves to repair themselves. So you have to expect like 3 to 6 months to start decreasing some symptoms, but something to go on at least.
Yeah, so thank you. I will consider the first three. I do have a question. So the orofacial specialist who I do see for TMJ stuff, what he was proposing, so it's, like you mentioned, he said something like, my nervous system is hyperactive right now. So anything little I do, stress, or because I am a student, stress or studying, that can just trigger it. Or if I sit down for a while, I start feeling the headaches and the nerve pain and everything that comes with that. So he mentioned like potentially exploring tricyclics because he said that would dampen or lower kind of my tolerance or increase my nerve tolerance, but I've somewhat been hesitant on getting on that for now. So I just said, let me just do rehab for a while and let's just see how things go over time. I did
Right.
cave into the endomethacin, and obviously I've been doing the other supplements, but I guess I'm somewhat curious about your thoughts on that tricyclic stuff, because like you said, I'm trying to avoid band-aid solutions.
Yeah, there's a role for these medications to work. So, for example, amitriptyline or duloxetine. These are the two main medications that are used for addressing pain, but they also, because they're part of the tricyclic class, they're actually antidepressants too, so they can have this effect on mood. And then there's a whole host of side effects. Some people find it really helpful. It's really trial and error. I would say your thought process is correct. Is like if you haven't implemented all the things that I've already just mentioned, start with those, and then progress to that if it doesn't get any better. Now, again, you just mentioned your nervous system's on edge. Now that's where that mindfulness and that's where some of those vagus nerve rehabilitation exercises play an incredibly important role, where there is a strong influence of psychology on these types of symptoms. Sometimes it's thrown around the terminology like, oh, your nerves are very sensitive. If it's neuropathy, which is, damage to the actual nerve, any stress will aggravate that, but at the end of the day, it's the nerve that has to be repaired, and that's where fueling it, I think, is the approach that I just shared with you.
Okay, sounds good. Thank you. So magnesium L-threonate, the lion's mane mushroom, and then PAL, right?
PEA, palmitoyl ethylolamide. Those are,
Okay.
I think, some of the top three. And I also mentioned carnitine and alpha lipoic acid. Those are probably the 5 top nutraceuticals that have been researched for nerve-related pain and helping nerve repair. Often formulations, good quality formulations might have all 3 of them in there, and you have to just take a little bit more of it, but that's the way to try. And then the medication LDN I suggested, as another option in the future.
Awesome. Thank you so much.
I want to dig in a little bit on what does the pain feel like? You're calling it nerve pain, but are we so sure that it's nerve pain?
Well, so the thing is, okay, so let me use the visual as the good example because I'm actually getting cleared for visual soon. So visually, I'm doing fine on these like convergence and divergence tests, right? However, I still have these like nerve slash eye aches that will come about,
Okay, well,
right?
so is it aching or is it burning?
Both. It can be burning at times, and other times it can be aching. So I feel that in the eye, in the neck, sometimes with the headaches as well.
Right. So most headaches are actually referred pain from the neck. And even eye pain is a common referral pattern for the suboccipital muscles. So you say you're doing rehab. Are they
Yes.
are they doing any type of soft tissue manual work where they're digging in? Are they able to recreate those headaches?
Um, okay, so with the trigger, okay, so they gave me it's a ball that I can use. I just lay the neck on it and it kind of hits on the trigger points. We did that for a few weeks, but but the question regarding them digging in with their own thumbs or they don't do that. No.
Yeah, so that's not going to be helpful. So a ball is going to be how it has a large surface area, right? But you need to get in with like one finger and you need somebody who's really skilled at it that can feel around and push right on the exact spot. Because right now, when you have eye pain, I told this story in Iceland. I was just at a conference in Iceland. But I was shadowing a chronic pain physician. Actually, Dr. Hrkal knows. I was shadowing this chronic pain doctor at a pain clinic in Toronto. This woman came in. She had a 10-year history of eye pain. She had had MRIs and CT scans, and they thought she might have a tumor in her eye, and no one could figure this out. And and she went to the pain clinic, and I'm sitting there being like, somebody's got to touch her neck, somebody's got to touch her neck, and I'm supposed to just be a fly on the wall. I was a resident just observing, and at the end no one touched her neck, and basically the diagnosis that was come up with was that it was some sort of psychogenic thing, right? And I finally spoke up and said, can I just check your neck really quickly?
Mhm.
And so I said, I'm going to push on an area in your neck, and I want you to tell me if you feel it just where I'm pushing or if you feel it anywhere else. So I pushed on the one side. She goes, I just feel pressure where you're pushing. I push on the other side, and she immediately goes, oh my God. And I said, does that feel like the pain you're feeling? She said, yes. And I'm like, it's a neck issue. So if they're not digging in and they're not skilled with their hands, they are completely missing it. Exercises will not work for this, right? So I did a 2-part series. If you go into the resources and go to my section and look at the live sessions that I've done, I did a 2-part series called Manual Therapy Part 1, Manual Therapy Part 2. If you go and watch those, it will explain all of these things and what you're looking for with respect to neck treatment because it's manual therapy. It's good soft tissue work that somebody who's skilled, like in ART or something like that, that can actually get in there and do this. So we're calling it nerve pain, but I'm not sure that it's nerve pain. It might just be a referral from the neck, and you might just have neck dysfunction, which makes sense if you're sitting for too long, it comes on because it's postural related, right? It makes sense for the TMJ as well. For the TMJ, are they putting on a glove and going inside your mouth and working on the muscles inside your mouth, or are they just giving you little exercises to do?
Okay, so I have for the TMJ stuff, they're two different people. So one of them is the orofacial specialist, and
Yeah, and they give
he
you the night guard.
yeah, the night guard and then the medication and the medicine. The PT person, he gave me exercises, but he has gone in and released the pterygoids before, but it's not like a frequent thing that's done.
Yeah. So the pterygoids are very intricately connected with the suboccipitals. So if you have suboccipital referral, which it sounds like you likely do, like I bet you that if I spent 2 minutes with you, I would be able to recreate your eye pain in a second, and you would just nail it right away. Okay, it's this. The pterygoids, if the suboccipitals are chronically tight, I will always, every single time I see you, I will do some suboccipital work, I'll do some SCM work, I'll do some deep neck flexor work, and then I'll go inside your mouth and release the pterygoids. And the suboccipitals will relax even further and those headaches go away. It's almost like instantaneous, right? So you may just need a different provider. You may just be doing the wrong type of treatment and you're focused on nerve pain, but it may not be nerve pain. Now, in terms of the numbness in the arm and the leg, has that gone away or is that still present?
So, a few months after the injury, that was very prevalent. And then when I decided to restart all the rehab stuff this year, over time, things have numbed down. But if I get extremely stressed or if I'm studying very intensely, then they would all flare back up. And then,
Right.
sorry, one more thing regarding the cervical stuff, they've done a lot of deep dry needling on me. I will say the main so the SCM and scalings, that's the point where we're finding a lot of like dysfunction, a lot of tight muscles there. And for some reason, the main protocol they give me for that is sensory motor work, because they say that my head doesn't know where my neck doesn't know where my head is at in space. So when we're doing a lot of the sensory motor exercises, it's teaching the muscles to contract better. That's how it was framed to me.
Yeah, but it'll just take a long time to get there with that. Right. So the way that I explain it, and I'll just kind of quickly share my screen and show you. I actually did this one recently. So actually, you know what? I'll show you from this. Sorry, I just got to find this. So this is the presentation I did in Iceland. Let me share my screen. Share screen. Share. You can see that?
Yes.
So the way to look at it is this. So manual therapy is in blue. So basically at the start, it should all be manual therapy to try and get things moving properly and functioning properly. Then the next thing is proprioceptive, which is sensory motor. Then that starts to kick in and then eventually overtakes manual therapy in terms of frequency and what you're doing. And then strengthening and stabilization comes in last. And then now we're trying to stabilize everything. So if you just do the proprioception or strengthening type exercises, you're missing this whole component here, which is actually very quick to do. Like this would be like if you get somebody who's good, like they can basically get your headaches gone in a matter of a few sessions, depending on what's going on. And then you start in with the sensory motor stuff to try and integrate those signals, and then you start to stabilize. So it seems like they're going for rehab, which is what a lot of PTs do because their manual skills generally aren't as solid. So they tend to revert to what they're good at, which is exercise. And you can get there with exercise. It's just going to take you 6 to 8 months. Whereas we could do this in 2 weeks if if you're good at doing it. Um, so it's really like manual therapy that may be missing from what you're going through. But what you're keying on here is like stress and stuff. So you mentioned that you're through Melinda's section, you're through the diet. How long have you been in the program?
I think I joined this program, I want to say either last week of January or first week of February. So I'm about 50 something percent through. I'm taking it slow.
Good. And you're actually implementing each of the steps and it's part of your everyday routine and you're doing all the things, or is it like you were just watching content?
No, no, no. So I will say that I've implemented things about 85%. I can't say 100% because again, I am a student, so I'm not going to be perfect about every single thing, but for the most part, 85 to 90%, I've been following things to the T.
Perfect. Okay, good. That's
Yeah.
good. That's
And
more
and
than
then
sufficient.
Dr. Marshall, I actually had one last question. So you've been mentioning manual therapy. I'm somewhat curious, like what's the fine distinction between manual therapy and massage therapy? Because the one thing I forgot to mention is that added to my treatment plan is massage therapy, especially focused on the cervical, to my cervical, the cervical related stuff, once a month.
So manual therapy is like somebody applying hands to you. So massage is a type of manual therapy. Chiropractic would be a type of manual therapy. Um, so oftentimes massage, especially when only done once a month, may not be enough frequency. You may need it more frequently. But massage also, if you go, I would say just watch the two-part series on manual therapy because I talk about the differences between them and what you're looking for. So the issue with massage is that there's no movement involved. It's like it's more like kind of surface level, whereas ART is like trying to separate muscle tissues because they get stuck to each other. Like your SEMs, for example, will get stuck to the muscles below them. So you actually have to incorporate movement as you do some release so that it actually pulls the muscles away so they can move better. Um, so if you watch that two-part series on manual therapy, you'll have a really good understanding of what you're looking for specifically. And that will just help guide you, I think, in kind of going forward to see to try and find, maybe a different set of hands or a different provider. Typically, my treatment protocol is like once per week for a few weeks and see where we're at, and then I start backing it off to every 2 weeks to then every 3 weeks to then every month, and then I'm done. Um, but yeah, you may just need a different provider because it sounds like you're having cervical referral, but no one is actually getting in there and addressing it to get rid of it. So you're assuming that this is you know, nerve pain. But to me, it sounds just like a typical referral pattern that needs to be worked out.
Okay, sounds good.
But
Thank
again, addressing all the foundational elements, right? Continuing to address like, what can you do in a stressful situation? Do you have the tools in place that you can bring things back down so that it doesn't start to manifest as all these other symptoms? What are you doing for autonomic regulation? Are you doing, regular breathing exercises? Are you doing any cold water exposure? Exercise is how you balance the nervous system as well. So are you doing regular cardiovascular exercise in that subsymptom threshold manner to try and bring so all of these components go into reducing sensitivity of the nervous system, helping to balance things, right? Reducing inflammation because inflammation in the nervous system is going to make it hyper aroused. So making sure we're being diligent on diet and removing foods that tend to promote inflammatory responses. Um, and then maybe incorporating some better neck treatment. I think you're going to have I think you'll get to the bottom of it.
Okay, sounds good. Thank you. Yeah, I do work out like 4 times a week and then I meditate 5 times a week. But yeah, I need to probably increase.
Yeah, I mean, meditation is one thing, right? But like activating the diaphragm and doing like some deep breathing type stuff. Like I do Wim Hof, for example. Some people
Mhm.
might find that a little bit intense, but you can do things like that where you're really getting diaphragmatic activation, humming, singing, chanting, all of that kind of, activating the vocal cords, helps with regulating the nervous system. Um, Cold water exposure, you may want to try getting into a routine of that, starting very small and gradually increasing the time that you do on that because all of those things help to just regulate the nervous system. Um, and then yeah, exercise. What are you doing for exercise? Are you going to the gym to work out or are you just doing cardio?
So I go to the gym 4 times a week and I start off first with 15 minutes cardio and then I proceed to do about 40 minutes of strength training and then I end it with like 10 minutes cardio.
Does that increase your symptoms?
No. So I think in the first year of the injury, when I would even just go walking, I would have an increase in symptoms. But over time, I think because I continued working out, my body just adjusted to things.
Okay, if it's not provoking your symptoms, that's great. You can keep doing that. I think that's fantastic.
Yeah. As long as I don't lift heavy.
Yeah, I mean, it's sometimes if people have neck dysfunction and they're doing weights, that can just aggravate things a little bit. But if it's not really provoking anything, then I think it's fine. I think strength training is great, and I think you should continue to do what you're doing because it sounds like you're doing well there. Um, but I would just try to like work on some of the vagus nerve stimulation, work on other strategies to reduce that stress when things get stressful, especially being a student and doing a lot of studying. When you're sitting for a long time, I would try to break that up with regular periods where you're standing and moving around and stretching out your chest and, just moving, because sometimes just staying in a still position will start to, provoke things. So making sure you're just kind of breaking things up and taking regular breaks throughout, getting some better manual therapy, I think, from somebody who can really address that. Like, try to find somebody, go through the manual therapy videos, look to see exactly what you're looking for, and try to find a provider that is more kind of in line with that. And I think that'll probably get rid of some of that eye pain and stuff, because a lot of people think it's a vision problem. It's usually not. It's usually a neck problem, because
Mm-hmm.
you're having eye pain, so you're like, there's something going on with my eye, but it's actually just referred from the neck.
Gotcha. Thank you so much.
You're welcome. Okay, next up is
Hi. Hey guys, how are you doing?
good. How are you?
Good. So I have a question about inflammation. So it was very helpful to listen to the participants before, because I could feel that I've had similar issues, and I've been kind of working through different parts of the puzzle going through the program. My diet is, so I think like it's a couple of things. Like there was a huge element of trauma, and specifically childhood trauma, which I've been working through. There's chronic inflammation. There's been like neck stuff that's been there for a decade. Like I was having cervicogenic headaches before. Nervous system was a huge component, and I worked through different parts of it. But something doesn't add up in terms of the inflammation. Like I do not take ibuprofen or any painkillers when I get headaches, and they're very severe headaches. And similar issues with like the stomach acid. And I've been working through different pieces of it. But is there an objective way to kind of understand where I am in terms of overall inflammation in my body? Because I'm doing all the right things. Like I've been doing, I would say, a concussion fix plus diet for at least 3 years consistently.
Mhm. Okay, so there are a number of objective ways, but I think from just what you've described where you're at, the type of inflammation that you're having is probably not diet related. A lot of people attribute persistent symptoms to inflammation. And while it can be an underlying issue, that doesn't mean that there is inflammation that is diet related that's involved. Just because you have pain and some dysfunction, there could be a mitochondrial problem with at the level of your muscle cells. There could be a nervous system overstimulation or a neuropathy issue. That's not what we would kind of term classic inflammation. I see this all the time with my patients. They, especially in my first consultation with them, they say, Dr. Hrkal, I have for sure have inflammation. I have all these symptoms. And then they list all these symptoms. We don't know that. We can check blood work. Like there's a marker called CRP, which is just a very general marker. However, I'll be honest with you, most people that are in the PCS category, it's not that they have really high levels of CRP in my experience. If they do, they almost always have some other underlying autoimmune condition. And that's why we have to like really look at that. The type of inflammation we're talking about, primarily in the course, is kind of a more generic term that describes a process that is happening at the level of the neuron or at the level of the muscle cell, but that's not something that's measurable from a systemic perspective. At least in my experience, there could be more sensitive tests, like some of the interleukin factors. This is what research is looking at, but that's not something that you can really readily test. That's a specialty lab, research study only type of thing.
Yeah, I was in Pakistan for some time, and I do remember him like testing me for interleukin. Like I have like all these, like he said, like I have these all, and I'm going through like a nutraceutical approach through him.
Good.
And like I have all these like really kind of small things that all add up and correlate. So there's some element of Hashimoto's, there's an element of gut dysfunction. I think the nervous system was a huge component, because whatever I was doing from a gut perspective wasn't working because the nervous system was overriding it. I
Okay.
think I'm a good part of the way there. But for me, like when I look at my concussion, like PCS scores, it's like the huge factor is the pain, and the pain is episodic. It comes and goes. Like it's a stressor. And the pain has kind of changed. Now I can actually feel it more in my suboccipitals, and I recently started going to a PT that does manual therapy and is kind of going through the but I was just wondering, I'm going in for my blood work for the functional provider, and I was just wondering if there's like any additional things, like if it's worth it, exactly like for CRP, is it worth it to add that to the blood work or not?
It's very inexpensive, I'll say that. However, I don't think it'll be fruitful in my opinion.
Okay.
It's just
Okay.
in my experience, it's not worth it. Like if you like when you say pain, just to be
Yeah.
clear, and I know Dr. Marshall's going to ask you about this.
Yeah.
Is it neck pain specifically we're talking about? Are we talking headaches? Are we talking neuropathic pain? Like there's lots of types of pain.
Yeah, so before it was more like mixed type headaches in the sense that they were episodic. So I would say it was migraine, but it was like one side of the head, usually more on the right than the left. And there was some like trigeminal like neuralgia involved. So like something would trigger it. It would start like it would go all the way down. Like I think my traps were involved. It would go all the way. Like my shoulder is still really tight. It's like shoulder, neck, all the way up, like radiates to the eye and to the jaw. And it would be about 72 hours. Now it's kind of changed more towards pain in my suboccipital, which comes and goes. It's not like too intense, but comes and goes, and obviously like that can go, that radiates to my eye or like refers to my eye.
Yeah. I personally, I don't think this is necessarily an inflammatory type of pain, especially if you're taking supplements that are anti-inflammatory. I'm assuming you're already doing that kind of stuff.
Yeah,
Like
black seed
turmeric.
oil, like I'm taking a bunch of stuff, and then like on my own, I'll make an herbal tea with fennel and licorice. Like I've just intuitively been adding licorice to it because I really liked how it made me feel, like fennel and cardamom.
It may not be strong enough, to be perfectly honest. Those are great digestive carminative teas, but to influence this type of inflammation, like for example, just to give you an idea, if it's related to a cervical facet joint, which is a joint, that is something that we can influence with something like ibuprofen. So when you take, let's say, I'm not saying you should, but if you took an Advil or even like an naproxen, does this make the pain that you described go away or get better?
I think for I don't take naproxen, doesn't suit me well. Like ibuprofen does. It stopped working. Honestly, there was a huge emotional component to it. So even if I would take it, it would come back until I dealt with the underlying emotional issue that was bothering me. And I think that's been a huge part of my journey. I become like it just stopped working. So
Okay.
I
maybe
haven't taken it. I have a higher threshold for cervicogenic pain. So I haven't taken it for that yet because I can deal with it.
So maybe initially it was much more in the inflammatory realm because the ibuprofen was working, but now there's other factors that you've described, like the nervous system, the psychology, absolutely can magnify pain. I think that's the best way. It doesn't like cause it de novo, meaning like from scratch. It amplifies what an existing dysfunction is because the nerves are absolutely interacting with all the muscular tissue. And so it sounds like there's most likely some sort of like muscular or structural issue that's causing the pain. That is classic, comes and goes. Sometimes your neck feels good and then you aggravate it. Yeah, I'll turn it over to Dr. Cam because this is like his bread and butter, but it sounds like it's no longer classic inflammation. I still think if you've tried just like kind of like you mentioned flaxseed oil and a couple of those
Black seed oil.
Yeah, honestly, those are really weak anti-inflammatories.
Okay.
Like you need like a high dose of specific turmeric or boswellia. These are herbs that are very anti-inflammatory. Then you'd be looking at magnesium, which has an anti-inflammatory effect. Some of the things I mentioned earlier on, like palmitoyl would be a great option because it has an anti-inflammatory and high doses of omega-3s. Like those 3 or 4 things, if you do them for 2 or 3 months at the right doses, if there is that type of pain that responds to ibuprofen, I find that works well.
Okay, thank you. I'll request that for my upcoming.
Yeah, but the right doses. The key is the right dose.
Yeah, he's given me really high doses of turmeric and everything, but I think I just haven't complained enough about the pain for him to address that. So he's addressing all like the functional issues probably, but I'll complain more about it.
And you said you're working with a functional medicine provider?
Yes, I am.
That's great.
Yeah.
So in terms of the neck and stuff, I think that it sounds like it's likely cervicogenic in nature. And there may be some joint components, like Dr. Hrkal said. So if you're seeing a PT, they might not be doing manipulation where that might be
I'm seeing a chiropractor and he does traction, but I felt like we do prongs. Um, we do like recently I started having him do those again, the prongs that go like behind your head to kind of release the muscles, and that helps. But I felt like the traction wasn't working and it just wasn't enough because I felt like my muscles were always tight.
Are you doing any adjustments though?
Yeah, he did. Yeah, he adjusts me. He adjusts me.
Okay.
But I find that the adjustments don't stick. So yeah.
Yeah, and sometimes it takes a while for things to hold, but um again, have you watched the manual therapy videos that I did?
Yes, and that's why, and that was kind of my impetus to go and add PT in addition, especially when I felt like my nervous system could now actually handle being in a PT clinic with like all the stimulation and everything. So, and I found somebody. Thank you for everything that you listed. I found somebody who has kind of hits all the boxes in terms of concussion management. She herself had a concussion, and I had my first session with her yesterday, and she uses kind of like, I asked her if this was active release therapy, but she uses kind of like her own approach. But I didn't know where I was. Like my proprioception was down because I didn't know where I was in space after she released the muscles, because I've never felt like I have so much tension in my neck and head. So she is doing and that's exactly what she was doing. Is she told me that we'll kind of wait to do the balance stuff later and the jaw stuff later, but she started working on me and has given me some like initial exercises.
Yeah, okay. Yeah, I think the manual therapy is the key, and like if you can get somebody to go in and start working on the TMJ and the pterygoids, that helps to release those suboccipitals. Um, so yeah, I mean, I think you're on kind of the right path anyway. It just might need a little bit more work.
And how long should I kind of give the manual therapy to see if it's like working?
Like within 4 to 6 weeks, it should be making a big improvement. If it's not, then you're probably in the wrong place and you need to probably switch providers.
Okay, and then dry needling, is that something that you would recommend?
I include that in my manual therapy. So when I'm working, I usually do needling with stim. So
Yeah.
I'll use some electrical stim on it, but I incorporate that in my treatment, right? So if I see somebody, I'm going to generally start first. I usually start with, an assessment to see what's going on, but then I'll do mostly manual therapy, soft tissue, ART, and then any muscles that aren't releasing well with just ART, then I'll put a
Yeah.
needle in it and stim it, and then
Okay.
I'll finish up with looking at any segments that need to be adjusted, and then I'll do that.
Okay. All right. Sounds great. Thank you.
Yeah. Okay, last up is
Hi. So I have been recovering from a concussion for the last 9 months. I got it in August of last year, and I went through the whole Concussion Fix program from like March to April, May, or maybe February to April, May. And so I kind of went down the line, and it's been really helpful to help me adjust who my practitioners are. I've been at a concussion clinic with like a neuro PT and like OT for since January, and I've been using kind of concussion fix to like add in acupuncture or trigger point massage people. Now at a chiropractor, and my symptoms have changed a variety of times throughout the whole 9 months. And right now, really where I've been for I would say the last like 3 months is that I've been having headaches that are really like served in the back of the head, really like what it looks like at the suboccipitals, and then nausea that has been kind of like 24/7 and has been getting worse with some of the chiropractic work that I'm doing. And the diagnosis is at the time kind of felt like they were like vestibular migraines and then also like these like cervicogenic headaches. And so with the neuro, like have tried some medication that like Amivig and now Emgality. And really I'm kind of just trying to figure out like where to go next. So I've been at the chiro for about like I would say like 3+ weeks after going and doing a lot of soft tissue work. And the chiropractor, like he thinks that my left clavicle is very out of place. And we've been doing some manipulation to kind of put it back into place. But he kind of was like, if we're not starting to see any benefits in the next like, week or two, I'm worried that this isn't going to be the continued path for you. And then just the last thing, based on some of the things that you were saying to the person before, is that when I've gotten like trigger point massages or when I've done like chiropractic work, like people can feel where in my suboccipitals like the pain is, but there's no re-triggering of the headache. So
it's just kind of there. And then my main triggers, which are unfortunate because they're constant, is like any screen. So like working in computer is like the thing that like makes my headaches like not go away. And so for the most part, like they're just kind of like there underlying as well as the nausea.
Have you had any type of like neurooptometry assessment to look at your visual function?
Yeah, so that is, I started both there. So I had convergence issues, but then most of my PT work was focused on that and kind of got cleared about like 3 months ago, plus did like a actual like eye exam and stuff. And so eyes was like the main thing that we were working on, and it got better. And I had a lot of eye strain in the beginning. And through acupuncture and through like my PT and vision like therapy there, it seemed to be like completely like that's gone away, and hasn't been like a huge continued issue, at least like the same symptoms.
It's hard to say. Like, I would love to put my hands on you, but a lot of times pain in the back of the head, we think it's coming from suboccipitals, but suboccipitals actually usually refer to the front of the head.
Okay.
Things that refer to the back of the head are things like the deep neck flexors, the SCM muscles, like a lot of things in the front of the neck will actually refer to the back of the head, or even tissues down lower, like traps, levator scapula, even like rhomboids, which is between the shoulder blades. Are they going kind of down chain and looking at other components? Like I'm always doing like pec work and subscap, and I'm looking at the hips and the pelvis, and are they going down chain, or are they just hammering the suboccipitals and hoping for the best?
Um, that's a good question. I think like my neck, where on the left side, just like the truly the like side of your neck was so tight that everyone was like really focused on getting that to like relax itself because it was causing like a really shortness in the left side of my body and then like kind of tightness that was down on my lower right side. But the manual work that's been doing is really focused on just that. Um, they're looking at how I'm walking and they're looking at other things, but I wouldn't say that there's been like therapy or any other like main focus below.
Because one of the things, like the way I always look at things is like, okay, that right side or that left side, or would you say right or left? I can't remember. But
Left.
so the left side is really, really tight. And a lot of people get just fixated on that and they go, okay, well, I'm going to do all this work to loosen up that left side.
Yeah.
And like the way I look at it is, okay, why is that tight? Usually something that's tight is tight as like it's like a reflexive response, right? Your body has tightened that up for some sort of reason. Now, what is the reason? It's usually a compensation for something else, right? So, for example, if your pelvis is torqued a little bit, it's going to make one of your legs longer than the other one. And as a result, your body's going to try, because your body's going to want to keep your head and your shoulders level. And so your body will do all these weird things to try and counterbalance the leg length difference that you have. So I'm always looking at saying, okay, that's tight, but why is it tight? And I often don't spend much time on the area that's tight. I'm looking for why it's tight. Because if I can fix the underlying problem, then that all kind of works itself out and the tightness dissipates. So it may just be finding a different, where are you located?
In San Francisco, California.
Okay. Unfortunately, I don't know anybody. But there are people that will kind of look at this more. It's just trying to find those right people. Um, I mean, to me, it still seems like there's a neck component to this, but it could be something down further. Like it could be something with the pelvis and that type of stuff. So, um, the chiro you're seeing, how do they do things? Like, what's their style? Do you know?
I've never done chiropractor before this, so I'm not sure that I have the best of like style versus something else, but he's been doing like he starts all the appointments with like some soft tissue work and then is looking at the minor like is trying to adjust the clavicle back in. He just had me get a neck x-ray yesterday and I'm going back to him today to look at results. I mean, based on my own very non-knowledgeable eye, it doesn't look like anything is super wrong, but I could be totally wrong there. And then he's done like every session he's done like in the beginning really minor adjustments because he was saying that like I have my flexibility and my like bones or whatever the right terminology is like a lot. So he was doing a lot of like minor adjustments in the beginning because he didn't want to like over adjust. And then we did a more major adjustment like on Monday. And I don't really feel like I thought maybe I'd seen some decrease in the headaches, but I'm not really sure that I have. And the nausea, on the other hand, is like gone way up from it. But he looks at like walking, he looks at other things, but he's like looked at posture and everything, as like making sure that it is just in the clavicle, but he hasn't like mentioned that there's other things in the body that are like super off.
Okay. Yeah, again, like I always say, I'd love to just get my hands on you. So can you send me a message on the platform? There's a few guys that I actually got to know in Iceland, and I'm gonna ask them if they know anyone kind of in the Bay Area for you.
That would be amazing.
Yeah, and we'll just see if there's any recommendations there. Just because I'm not in the U.S., I wasn't trained in the U.S., but I met a bunch of American guys when I was in Iceland, who like really understand the integration of these systems. And if they have anybody in the Bay Area, then I can send you that contact.
Okay, amazing. Yeah, because I think it's like it does feel it's like just keep trying to figure out where the pain is coming from, but I'm getting a lot of like dead ends or people who are like, oh yeah, I think that there's an issue here, and then like we like go and we fix it, and then it's like, okay, well the pain hasn't really changed, so like maybe
Yeah,
like
and it's tough, right? Because it is a lot of trial and error. Because even when I'm working with somebody, I'm like, well, I think this is the issue, and we work on it for a bit and it doesn't work. Okay, I'm missing something. I'm gonna I take another look, right? Okay, now let's try this. Okay. Oh, that seemed to make some sort of change. Okay, let's keep pulling on this thread for a bit. Okay, we've hit a plateau. Okay, now what else am I missing here? Let's go and reevaluate. Or I'll say, you know what? I'm gonna refer you to somebody else for a different view, a different set of
yeah,
hands. It's very practitioner dependent, right? Like there's a lot of people that I treat, it doesn't do anything, and I have to refer them to an osteopath, and that's just a different set of hands, a different style, different approach, and that really works well for them. So every patient is different, every practitioner is different, every style within the practitioner, like every chiro is so different from any other chiro that it's hard to say like, oh, I've tried chiro, that's it. Like, well, no, you have to maybe try 6 or 7 before you find the one that actually finds the issue that is going to work for you. So and sometimes this stuff just takes time as well. So, usually if you're not seeing results in like 6 to 8 weeks, then I'm going, okay, something's being missed. And either that particular person needs to reevaluate, or you need to find a different person to take a different look and a different angle and a different set of hands. But send me a message on the platform,
okay,
and then I will reach out to a few of the guys that I met and say I'll ask them if they know any good people in San Francisco area, and then I can send you some ideas that maybe you can try out.
perfect, thank you. And I guess just like it also sounds like, and potentially it's not actually cervicogenic headaches, and that it is being referred to like, or maybe not cervicogenic, but suboccipital, and that like it might actually just be a different location based on like the pain not being at the front of the head.
Yeah, so like a lot of the time, like I said, like a lot of the muscles in the front of the neck will actually refer pain to the back, and the muscles in the back of the neck will refer pain to the front. So it's, it could be something with deep neck flexors. It could be a TMJ issue that's causing some of it. It could be SCMs. It could be some other things that may not being looked at, because everyone gets hyperfixated on the area of pain, right?
Yeah,
Like, oh, I have this shoulder issue, so this guy's focused on clavicle. But why is that an issue? Well, this could be a like a reflexive response due to some other factor that no matter how much you work on that, if the problem is in the right hip, then you'd have to go to that area to be able to figure that out.
got it. Okay, all right. Thank you so much.
You're welcome.
Great spot to wrap up this week's Q&A. Thank you to everyone who came on, asked questions. I hope everyone has a fantastic day. Bye.
Thanks for joining us. See ya.
Thanks, guys. Bye. Thank you for tuning in to the Concussion Fix podcast. We hope you found today's episode helpful and that it gave you a little more clarity, hope, and confidence on your road to recovery. Remember, every step you take matters, no matter how small it may seem. If you feel that you could use a little more support on your healing journey, check out the Concussion Fix program. Just visit concussiondoc.io or simply type Concussion Fix into Google and read some of the reviews from people who've already walked this path. With over 3,000 success stories and an average symptom reduction of nearly 50% in just the first few weeks, it might just be the help you need to break through. Thank you again for listening. If you found value in this episode, please share it with someone you think could benefit, and don't forget to subscribe so you never miss a session. Until next time, stay hopeful, stay curious, and continuously remind yourself that recovery is possible.